Afternoon. It is great to be with you today. Welcome to the 2021 Innovations in the Science of Cannabis Conference, put on by the Michael G. DeGroote Centre for Medicinal Cannabis Research. My name is James MacKillop. I'm the director of the center, and on behalf of myself and our associate director, Dr. Jason Bussa, I'm delighted to welcome you today. This has been a long time coming. Our last conference in May of 2020 was canceled because of the COVID-19 pandemic, and the disruption and hardship that has been brought on by the pandemic is hard to overstate, as I'm sure everyone appreciates. But I am so delighted that we are able to resume this year and put on the meeting that we had hoped to put on last year, updated with another year of data and progress. And in spite of all the disruption, in many ways, the science of cannabis has continued, and perhaps is even more salient in the context of changes in behavior within the context of the COVID-19 pandemic. I'm going to offer some introduction to the conference today and also provide an overview of the meeting. And then we'll have our first keynote speaker. To provide first some disclosures, I do want to be forthright about the fact that I do receive unrestricted research funding from a variety of different sources, including both philanthropic sources and governmental organizations. I am a principal in a startup that is commercializing psychological measures, but I do not have any consultancies to or ownership in any commercial cannabis entities. I don't own any stocks. I don't have any formal consulting relationships. And it's important that you know that the Michael G. DeGroote Centre for Medicinal Cannabis Research is entirely supported in terms of its central operations by a philanthropic gift to the Michael G. DeGroote Initiative for Innovation in Healthcare. For us, it's very important that our core operations are supported by entirely unrestricted funding sources. I also want to acknowledge a number of people and organizations in launching the meeting today. To start with, our funding support comes from the DeGroote Initiative for Innovation in Healthcare, directed by Dr. John Kelton. We continue to be very grateful for that funding support. It is the foundation on which the center rests. I also want to thank the DeGroote Centre for Medicinal Cannabis Research Conference Advisory Committee. And that includes myself, Dr. Jason Bussa, Doctors Jennifer Brash, Ramesh Sakarias, Marissa Slavin, Lean Naji, and Michael Van Amerigan. And this group has really put in a lot of work in terms of thinking hard about the content for this year's conference, and indeed how to put on an engaging meeting during COVID-19. I'm very grateful for their efforts. I want to, of course, thank the speakers and the participants in this year's meeting. We have representation from across Canada in terms of attendees, from across the United States also, and even as far away as Oslo, Norway, I understand. And we have an amazing lineup of speakers this year. We have 4 fantastic keynotes, real leaders in the field. We have 4 excellent foundations lectures, I believe, and we also are going to have updates from national research organizations across Canada. And finally, I want to kind of orient everyone to the center by introducing our vision and our mission. Especially for those who are new to our meeting, I want to set the table a little bit, because the vision of the DeGroote Centre for Medicinal Cannabis Research is really evidence above everything else. We envision an evidence-based understanding of medicinal cannabis, including both an understanding of its therapeutic effects and an understanding of the associated risks. We want to look at both sides of the coin. We're not opponents of cannabis. We're not proponents of cannabis. We're pro-evidence, and that is the vision that guides everything that we do. In terms of our mission, the mission is to leverage the highest standards of research methodology to advance the understanding of medical cannabis. And that really has three active ingredients, so to speak. We're seeking to do this by curating the existing body of knowledge on medicinal cannabis. At McMaster, we're creating a network of researchers and clinicians who are dedicated to an evidence-based understanding of cannabis. And finally, the core of our center is a pilot funding program in which we provide support for principal investigators at McMaster to germinate new innovative research projects that will advance new knowledge in the area of cannabis research. What this looks like is very multifarious. One of the things I'd like to highlight for people who are attending this conference for either continuing medical education or for education in general is that our focus on curating the evidence base includes a 3-course certificate that is offered by the McMaster Center for Continuing Education. These are university credit courses that lead to the certificate. One course is on fundamentals, a deep dive into the cannabis plant and cannabis in general. A second course exclusively focused on cannabis risks and harms, and a third course focused on applying evidence-based medicine to understanding medical cannabis. We also have a variety of different knowledge translation products that are available on our website, research summaries, evidence syntheses, ways of connecting primary scientific literature to the larger public. And for the first time this year, our conference is accredited for continuing medical education credits. So our foundation sessions, each one following a keynote lecture, will be viable for CME credits for those who are physicians and would benefit from them. In terms of our mission of creating a network, we've been delighted over the last few years as our center has accumulated a very large number of faculty affiliates, more than 40 at McMaster University, representing a variety of different departments: psychiatry and behavioral neurosciences, anesthesia, obstetrics and gynecology, palliative care, primary care, pathology and molecular medicine. Really across our Faculty of Health Sciences, we have representation reflecting the remarkably interdisciplinary perspective that we're taking on cannabis. Again, we have no agenda here beyond advancing the evidence around cannabis, and a strength of our center is that it is a big tent in which a lot of different voices can be heard, either studying medical cannabis or recreational cannabis use, or areas that sometimes span in between the two. And then the core of the research that we conduct is our research program, which focuses primarily on therapeutic benefits. On the one hand, we started focusing on pain, in particular cannabis for either cancer pain or non-cancer pain, but this has really expanded to now increase our focus on cannabis for sleep, cannabis for anxiety, cannabinoids as novel products for antimicrobial resistance, and also cannabis for alcohol use disorder. On the other side is our focus on adverse consequences, where we are particularly interested in addiction to cannabis or cannabis use disorder, but beyond just addiction to cannabis, a variety of other risks and harms associated with cannabis, including neurocognitive consequences, the exacerbation of psychiatric symptoms or disorders by cannabis use, and lung harms that can result from inhaled cannabis use. Across these domains, it's not lost on us that our center was launched right before legalization of recreational cannabis in Canada. So a common theme also is monitoring how legalization is changing the landscape in terms of medical cannabis and also recreational cannabis use. To give you some center updates, it's been an exciting year despite all the disruptions resulting from COVID-19. For the first time, we have obtained an institutional research license to conduct cannabis research at McMaster. This is important because it means that for a lot of research projects, we can actually approve those projects internally without having to go to Health Canada now. And after a more than 2-year undertaking to get an analytics license, that license was just awarded last week. So we are now able to do on-site analytics to precisely characterize the composition of different cannabis products here on campus. I want to give enormous thanks to Jennifer Robertson and Tracy Campbell, who really led the charge on this and were invaluable in their persistence and creativeness in finding ways to meet all the Health Canada requirements. Our pilot projects number about a dozen at this point and have been continuing despite all the disruptions. There have been some delays, but I've been very happy to see how diligent and committed our pilot PIs have been. And our trainees have, at this point, to a large extent, completed their training with the DeGroote Centre, and we are planning on launching a new trainee call in the fall to recruit new postdoctoral fellows and predoctoral trainees to the center. And I also want to congratulate a number of our faculty who have received federal funding for their research on cannabis. For example, a number of faculty have received funding to study the intersection of cannabis use among women, including Sarah Green, Meredith Vanstone, Allison Ion. David Collister received federal funding to continue to study cannabis for uremic pruritus among individuals with diabetes. Jason Busser received funding to complete his guideline on cannabis for chronic pain. I was fortunate to receive funding to continue my observational longitudinal cohort study on the effects of cannabis legalization. And Suzanne Archie was funded also federally to continue her work on cannabis and psychosis in racialized youth. So it's been an extremely productive year, despite all the disruptions. And we have a really exciting conference. We have 4 world leaders in cannabis research. Today, in just a couple of minutes, we are leading off with Dr. Stacy Gruber from McLean Hospital, Harvard Medical School, who will be discussing cannabis and cognition. Tomorrow, we have Dr. Oren Davinsky giving us an update on the extremely promising story on cannabidiol as a novel treatment for rare pediatric seizure disorders. On Wednesday, we have Dr. Yasmin Hurd from Mount Sinai School of Medicine on her research on cannabinoids for the treatment of addiction. And on Thursday, we have Dr. Robert LaPrairie from the University of Saskatchewan giving an update on his research on natural and synthetic CBD. These are all synchronous keynote sessions, but will also be recorded in our YouTube channel for individuals who may want to watch them in the future. We have a number of asynchronous presentations from national stakeholder groups. So from the Canadian Institutes of Health Research, Dr. Nina Clooney will be giving an update on the Integrated Cannabis Research Program. Dr. Rebecca Jessamine will be giving an update from the Canadian Centre on Substance Use and Addiction. Dr. Sheldon Mellis will be giving an update on the research program at the Mental Health Commission of Canada. And Dr. Jean Costello will be giving an update on the research happening at Homewood Research Institute. We have our foundation sessions, which will be synchronous, given every day after the keynote speech. And again, these are CME accredited. I will be giving the both fundamentals lecture today and the risks and harms lecture on Wednesday. Jason Busser will be giving the evidence-based medicine and medical cannabis lecture tomorrow at 3:30. And Doctors Ramesh Zacharias and Vikas Parahar will be giving a practical introduction to medical cannabis prescribing on Thursday at 3:30. We hope that these will really give people a deep grounding in both the fundamentals of cannabis risks and harms, and also practical applications. And then finally, we have a number of asynchronous research project presentations. This is just a sampling. I hope I'm not overlooking too many people, but I want to really highlight some of the presentations from faculty and trainees affiliated with the DeGroote Centre, with St. Joseph's Healthcare Hamilton, and also presentations coming from our colleagues up the road at the Center for Addiction and Mental Health. I do want to offer a couple of housekeeping points. The first is that you will hear, unfortunately overhead, that I'm in the hospital, so there may be occasional interruptions, but hopefully there won't be too many. Also, in terms of where to go every day, the Zoom link should be perpetual. So anytime you want to come to the conference, you should just click on the same link that you clicked on today, and that should take you to where you want to go. If you want to ask questions, you should see a button on your control panel that says Q&A. That will pull up the Q&A portal, and you can put your question into that portal. And Alan Fine, our research coordinator, will be the moderator of the question and answer period. And if you have any trouble navigating the system, do just shoot an email to cmcr@mcmaster.ca, and hopefully we'll be able to help you out. I do want to especially highlight Alan's indefatigable efforts in putting together the meeting this year. He's been an absolute trooper in taking our meeting online and has put many hours into organizing things. Thank you, Alan. And with that, welcome to our meeting. We'll be launching in just a moment with Dr. Stacy Gruber. This is our first virtual meeting, so please do bear with us if there are any technical difficulties, but we're delighted you're joining us, and we're very excited for the next few days. Welcome.